The motivation behind this study is something that sadly is in the news a lot these days, which is that there is a healthcare human resource crisis. In Zambia, as in most sub-Saharan African countries, there are severe shortages of health staff. And there are severe shortages at every level, from the doctor to the nurse to the person below the nurse. Okay? In Zambia, the population is about 12 million, and there are about 600 doctors. Okay? So for every 100,000 Zambians, there are 7 doctors and 100 road nurses. These shortages undermine effort to combat malaria, HIV/AIDS, and other diseases. One possible solution that many NGOs have been proposing lately is to engage individuals who are embedded in Zambian communities to provide at least some of the most basic health services. And these range from providing services to selling products. In this study, we collaborate with Society for Family Health Zambia. And what they do is that they train hairstylists to promote and sell female condoms. HIV/AIDS prevalence in Zambia is 14%. And the reason why they want to work with hairstylists is that they're ideally positioned to promote change within their communities. They have a trusted relationship with their clients, and they have many repeated interactions. And actually, while this might sound bizarre, it turns out that in England, not until kind of recently, barbers were selling condoms. These are not the regular male condom that you're used to. These are female condoms. I won't go into great details of what female condoms are, but you can imagine it's the same principle as a condom, but it's used by the woman rather than the man. And the reason from a public health point of view that it makes sense to promote female condoms is that they can be used way earlier than the actual intercourse, so there's no interruption needed. And also they put women in charge of reproductive and protection choices. So that's the main reason why they're being promoted. And this is your standard hairdresser salon in Lusaka. Now, the paper that came out of this study is entitled No Margin, No Missions, Incentives for Public Service Delivery, and is co-authored with Nava Shraff, who's at Harvard, and Kelsey Jack, who's at Tufts. What we do is that we design and implement a field experiment with SFH, and what the experiment does is to compare financial incentives and status incentives for the agents whom are hired to distribute condoms. So those hairstylists, which I showed you in the picture. The idea is to provide the first evidence from a randomized controlled trial on the field on the effect of status and financial incentives in an organization and on the relevance of motivation crowding out. So let me just give you a brief background on this issue. We know from the private sector that financial incentives work. You pay people to do something, they do it. But recently there's been a lot of economic theory suggesting that perhaps that wouldn't work in the same way in the public sector. And in particular, the idea is that people in the social and public sectors are self-selected because they care about the cause. And paying them to do what they would have done for free anyway might actually displace that intrinsic motivation which they had and which made them sign up for the job in the first place. This might be a real concern, but we have no empirical evidence as to whether it's relevant on the field. Okay? So that's what we aim to do in this paper. The context, as I mentioned earlier, is one in which SFH recruits hairdressers and barbers to distribute female condoms in urban compounds. There are thousands of salons, they're in all neighborhoods. They have very good client relationships, often the same client goes back to the same hairdresser. And the interesting thing is that clients are captive while they're getting their hair done. And this takes a long time. The average time that a woman spends at the hair salon in Zambia is about 2 hours. Men is shorter than that, but it's still a substantial chunk of time during which the client or patient is sitting there and the hairdresser can explain the benefit of the female condom. So the goal of the experiments, as I mentioned, is to compare the effectiveness of these 2 types of incentives, the standard financial. Sorry, I shouldn't move. I'll stay here. I'll stay here. I tend to move around, but I can stay put. Okay, so as I mentioned, the experiment goals were twofold. The first is to compare 2 types of incentives that can be used. That can be used to motivate these people. These are financial incentives and status recognition. And the second is to test whether either type of reward, or perhaps both, crowd out this intrinsic motivation. So how do we do that? Well, first we need to know who we're dealing with. So we ran a census of all the hair salons in Lusaka. We find that there are about 2,500. We then randomly assign 1,200 of these salons to 4 treatments, which I will describe in detail in the next slide. Once they've been assigned to treatment, we don't tell them that, because we don't want salons in one treatment to find out about the other treatment, but we invite them to a training program for the distribution of female condoms. Once they're at training, we run an experimental game to measure their intrinsic motivation for the cause. We then follow them up for a year, measuring their sales and measuring other characteristics of the clients whom they target. Okay, so the experiment runs in these stages. We first collect information on all the salons so that we know the population. We then assign them randomly to 4 treatment groups, and then we follow them for 4 years to see who performs better. We finally run a customer service to complement our sales data to see what customers know about this program and detail mechanisms. Now, here are the 4 incentives group. All the stylists sell at the same price, is 500 kwacha per pack. They buy from SFH, and then they sell in their salons. The control group is a standard volunteer treatment. This is what SFH was doing before we started working with them, and this is what they do for the distribution of many other health products that they distribute through community agents. They basically ask the agents to do this out of their motivation for the cause. In the second treatment, we give them some financial incentives, but these are very low powered. We give them 10% of the product price as a margin. In the third treatment, we give them as high financial incentives as we possibly can. We give them 90% of their retail price as a bonus. Okay? The issue is that if you give them more than that, they would have the incentive to buy the condoms and then throw them away in order to get the bonus. So that's the most we can give them. And finally, we implement something a bit different, which is a status treatment, where we reward them with stars. The fact that I have children in primary school kind of informed the design of this study. We give them a chart like that, and for every pack of condoms that they sell, we stamp a star on the chart. And as the chart fills up, I'm not sure you can see it, there is a line that says contribution to community health. So this links directly their performance in the sales of condom to the good that they do for the community. The more condoms they sell, the more encounters they protect. And so the idea is to reward them not with money, but with a signal of their contribution to community health. We then collaborate with SFH and we keep all their data. So we have all their invoice data, so we can see how much has been sold. And we have a sales logbook where participants are asked to record condom sales and customers' characteristics, so we can have a sense of the targeting. And finally, we do a long customer survey with 2,000 individuals in 16 marketplaces to get a measure of their knowledge of this product and to try to link their knowledge to what the hairstylists have told them. Now, this is our first finding. In the interest of time, I will discuss only the 2 main findings of the study. This is a quite striking findings. The gold line stands for gold stars, so it's easy to remember. And the other groups are all the other treatments. Okay? You see from here that agents who are rewarded with the status good, the stars, sell twice as many condoms as any of the others. So status incentives are effective and financial incentives are not. This is kind of surprising, unless you believe the financial incentives do indeed crowd out motivation to such an extent they are completely ineffective. And I will return to that later. The first thing that I need to tell you, though, is that this is robust to the inclusion of a rich set of salon and agents characteristics, which is what you would expect given that the treatments are randomized, so they're not correlated to any salon or agent's characteristics. One possibility, our best guess for why these incentives do not work, is that earnings were very low, even in the high margin treatments, because this is a product that's very hard to sell. So sales levels were low. But of course, sales levels were low also in the status treatment. So why did one work and the other one didn't? Well, the status treatment has something unique about it. These agents sell many different products. They sell hair products, they sell clothes, they sell shampoos and the like. And all of these products, they sell phone cards as well. All of these products pay them a margin. So it's easy to make money by selling products. Many products offer you that opportunity. But this was the only product that gave them stars and social recognition in that form. So it might be the reason for why stars were effective and financial incentives were not. Yeah, very good. So we do some work in trying to disentangle the mechanisms through which stars work. One finding that we have is that the stars seem to be a lot more effective in areas where there are many agents who receive stars. And we do some qualitative interviews among these groups, and we find that they're using the thermometers as a mean to compare themselves to their peers. So they go to the next salon and say, let me see how many stars you have, or I've got one more than you, I've got one fewer than you, and that kind of reinforces the effect of the status good. We have a long set of checks and a side experiment as well to rule out one possible alternative explanation, which is that the stars do not motivate the stylists, but rather they look good and they motivate the clients. So they act as a marketing device. In the interest of time, I can't go on telling you how we ruled that out, but if you're interested, we can talk after the talk. Now let me go back to the second big motivation behind this study, that is try to measure whether financial incentives crowd out intrinsic motivation. This is the comparison between the control group, is the green one, the high stakes, the red one, and the low stakes, the blue one. You see there is basically no difference. There are no confidence intervals there, but you don't need them really, because there's basically no difference whatsoever between these three groups. So what that suggests is that if there is crowding out, you're in a really strange knife-edge case where the crowding out is exactly the same as the level of as the effect of incentives, so that they cancel out perfectly at both level of incentives, which is kind of bizarre. But we can test this directly. We can, in other words, look at the people who have motivation that can be crowded out and test whether indeed incentives are less effective for them. How do we do this? Well, during the training program, we implemented an experimental game that allowed us to measure how motivated the stylists were to sell condoms and to work for the cause of HIV. And so we can then test whether the effect of incentives is weaker or even negative for them. Because the theory suggests that if you're intrinsically motivated to do something and then I pay you to do it, then you do less of it. Right? We find exactly the opposite effect. The high-stake treatment, which is the red one on the right-hand side panel, and the star treatment, which is the yellow one on the bottom right-hand side panel, reinforce intrinsic motivation. So they help stylists sell more, but if the stylists are intrinsically motivated, they sell even more. So there seems to be a complementarity between these rewards and the people's motivation to do the job in the first place. So what lessons do we draw, and this is my last slide, what lessons do we draw from this study? Well, at some point I had the brilliant idea of presenting this in front of the then director of LSE, who's my boss. And so I realized that I was talking about paying people in stars instead of money, and I was feeling very stupid about it. So next thing you know, my paycheck has a big star on it and a 50% pay cut. So of course that's not what we were advocating. You know, stars cannot replace money as the main mean of payment. But the point that we're making here is a different one, is that when performance pay accounts for a small share of total pay, they can actually motivate people to do better. What we need, and what this paper does not do, it does not look at the selection margin. The way the study was designed in order to prevent contamination was to take a bunch of people who had already signed up for the job and then give them different incentives. Now, the biggest effect, I believe, could come from the other margin, that is, from changing incentives and understanding how this affects the selection of people who sign up in the first place. And this is where we're going in an extension of this research in collaboration with the government of Zambia, not sponsored by 3ie, but perhaps, who knows. We're working to understand how offering financial incentives to health workers help attract talented workers vis-a-vis attract the wrong type that do this for the money. And the results of that research are not here yet. I'm done with that.
Okay, thank you very much.